Hi.
Hello.
Kristin. Nice to meet you.
Is it Ran? Is that how you say it?
Ran. R-A-N.
Nice to meet you.
Nice to meet you too.
Shooting it raw?
Yes. Shooting it raw.
I guess how I would use it, it's trying to capture that feeling, that essence of the moment. And then also the artistic part. I love when a good photographer can capture the lights, the nuances, and it's just an exciting feeling to see a beautiful picture. I'm sure there's many other reasons people do photography, but yeah, to me, it's like half and half. There's a feeling, a story, an essence, and then a beautiful image that's like art.
Great. You knocked it out of the park. You answered it in English.
Oh, is that the baseline?
That's the baseline.
Well, I guess I'll do fine then.
Yes, you will. Yeah,
I'm used to being the person who's asking the questions, not answering the questions. So this is going to be a new experience for me.
Like I tell all the people I meet, let's start with the assumption that I'm an idiot. Well, we'll get to wherever we get to. I have no idea. The reason the photographs are there is that by asking you to just pick 4 photographs of yours to put in this podcast, you're subconsciously or consciously curating the discussion. Mm-hmm. And while you sleep, it's all happening. And I don't know what's in that head of yours. And it'll emerge and then we'll see. So
like a projective test in psychology.
Is it?
Yeah.
You see, I told you I don't know stuff. Okay. The first photo is this one here.
Oh, yeah.
So usually I like to describe it because people are listening. That's what an idiot I am. I make a podcast about photographs that people can't see. So it's a lovely sunset. The sun is probably, it looks like it's just a couple of feet over the horizon, which is water. Mm-hmm. And so the dominant colors in the image are black. The silhouette is, it's like your palm trees or something. Mm-hmm. You can see the water. It could be the ocean, it could be the sea, it could be anywhere. And you've got a bit of cloud, just golden, baked in this beautiful sun. You're shooting into the sun, so it's blasted out and all this stuff, but clearly this is a moment.
I love hearing your description of it.
Oh,
as someone who's such a novice, it's fascinating, because you're in that moment and you know what you see, and then you just described it in colors and ways I wouldn't have thought of.
Right.
But I even feel that picture right now. So I lived in San Diego, California for 15 years before moving to Hong Kong 2.5 years ago. And that is from our roof deck of our house in San Diego. That's still there.
You poor things.
And it's,
how beautiful.
It is, I can just feel it because I'm sure I must have had a nice little glass of Chardonnay sitting there, feeling the sun, the warmth of it, and seeing it go down over the horizon. And it just kind of energizes me when I see it. I could just sit up there every day and watch the sunset. You just don't get bored of it. So, yeah, that had a lot of meaning. First of all, that's like a fall-winter sunset because you could see it over the ocean at that time. In the summertime, the sun goes back behind the hill.
If you look really carefully, you can sort of see Hong Kong.
You know what? I think that's what I was looking for. It's somewhere out there.
It's right there.
Yeah. So, most people in San Diego, too, are like beach lovers, sun lovers. Yeah. Every day you're in it. So, and then capturing it as it goes down. And sometimes if you're lucky, you can get the green flash. So
what was the time of your life that when this was made, where were you at? Were you about to move to Hong Kong? What was going on? Were you anticipating a pandemic?
It's so funny.
Nobody was.
Well, it's funny. I'm thinking that picture, I probably have a couple hundred of them because I love the sun. Yeah. I love the beach and I love that time of day. It's very still, very calm. But I do think that I looked back in my pictures. I do think that was past year before we came to Hong Kong. So probably knowing that there's a potential of coming here. Mm-hmm. Yeah. So that was probably in that moment. But the stillness. For some people, it might just be it's a nice sunset and that's pretty and great. It's palm trees, nothing wrong with that, right?
Right. We can move on because I think sometimes it's like dissecting hairs, and it's more like what can we uncover, and so. In this, to set the stage.
It's home. It's also home. you'll see these pictures. I'm like, oh, I know what was going on. I picked them when we were first talking about meeting, I don't know, over a month ago. Sure. And that homesickness, was coming on. It just that sense of, oh, I thought Hong Kong was going to open up sooner. I thought we were going to be able to travel. And part of me coming here is that I'd go home like twice a year if I could. Okay. All my family's in California. So that just resonated with me, not just because it's a beautiful sunset. Anybody likes a beautiful sunset, but it was like, those still moments of home. And I love it here. This is another home. But that really resonated with me about that.
Let me decode this image. Okay, so somebody's making a photograph of you.
Yeah.
And your arms are splayed open wide.
Yeah.
Your eyes are kind of almost closed, hard to tell. You're standing on the beach. There's some rock. There's some sand. It's a beautiful day. It's sunny blue sky. You're wearing a shirt that says love.
Yes.
And your hands are open to the world. Your face is open. Your mouth is open. Your ears are open. Your eyes are closed. What is this?
What do you think I'm feeling in that?
I don't know. I would say kind of open, but this is great. Like,
oh, that's pure joy. That's just love. I mean, that shirt. It wasn't like I put it on for the camera. It was just like I love. Again, guess what? The beach. That's not far from where I have a house. Mm-hmm. And it's just the sun, the warmth, the ocean, just feeling this pure joy of goodness, of just love in that moment. You don't really need much just to feel joy sometimes. It's just being an element that you really appreciate and you can feel. And I'm very much a sensor. So when I'm feeling the sun and being very mindful, right? I use mindfulness in my work. That all of your 5 senses were stimulated in that moment. And it's just pure joy and love.
So what's interesting about sitting and talking to people, so I've done work in recording and performance and that kind of stuff. So when you're doing recording work, even narration, sometimes you sit to do the dialogue and sometimes you stand to do the dialogue. So right now you're expressing, you're speaking about what you're like, your work, what's in the image. And as you're speaking, your eyes are wide, your arms are splayed, you're expansive. And it's amazing because I don't know if I'm doing this to translate for the people who are listening only, but if everything is an expression, you describing who you are and how you are and all this stuff communicates by your body language and all this stuff. So we're going to use this image. We're going to come back to it, I imagine, only because it anchors in your work, which is actually why I was just like, we have to talk. We have to talk. So, yeah. And I just got off my seat because I'm so excited. So in the next photo, what are we looking at?
I think those are called dogs. Those are dogs.
Okay, dogs.
But there's a reason those dogs are in the photo. Obviously.
Okay, these are your clients? This is who you help?
Typically, yeah.
Okay, dog psychology.
Really fluffy dogs.
Okay.
Yeah, Shiva is the white one, Chow Samoyed mix, Lola is the other one, like a lab, border collie mix. Those were my pups. That's who I...
Are there pups in Hong Kong?
No, they were... They're no longer with us.
Oh.
But they were my kids
okay.
for 16 and 17 years.
Wow.
So, again, you can see the theme. Just that feeling of the roots of where I came from. And they were in my life up until a few years before I left Hong Kong for one of them and about a few months before I left for Hong Kong for the other.
So there's various recurring themes in the podcast because it reflects what my interests are. One of them is, I've got pets at home. Uh-huh. So there are different people who have been on, who have talked about, actually very recently, Katrina, or Kaz, talks about her connection to around animal welfare and specifically introducing Hong Kongers to dogs and cats. Mm-hmm. And we were having a discussion about a dog's lifespan being shortened compared to ours, and they are such important companions to us in terms of our emotional connection. And then you describe yourself as a sort of really tuned in to your emotional state. Mm-hmm. You look at the photo, I could see it on your face. And it's true. It's like like how I described it, to Kaz, was like, it kind of hits you in the feels that, it's like there's something about these animals and their presence in our lives that lets us tap into that in a more honest way. I don't know necessarily if we're looking at other photographs, you would necessarily have the same expression on your face as when you just did, and when you do, looking at those images, at the images of your animals.
Yeah. Oh, well, animals in general are special to me, and anybody who knows me, I think they're all my friends, and I don't know, I have this weird, strange connection with animals.
You describe them as your family.
They were my family. Well, you know what, as someone who doesn't have human children, they were kind of like my kids in a way. You know, you're raising them for that long, they kind of feel like kids in a way. I know they're not the same, but I was a dog mom. So yeah, they were in my life for a long time, and they were really special to me. And yeah, I thought about getting some pets in Hong Kong, but I just think it's probably best not to. So it was a transition coming here without them.
Sure.
But yeah, they're very special.
Yeah.
I mean, I even have pictures here, which...
For sure. Yes, you're pointing to the wall, and there are photos of 1, 2, 3. Okay, let me describe your office. It's perfect. It is just absolutely, as a visual person, it is absolutely perfect. On the right, there's this amazing bookcase with your family, and then you're also your degrees, I guess, or certificates.
Yeah.
Or I know you're interesting outside of your work, but for me, I personally have a draw to the American Association of Sexuality Educators, Counselors, and Therapists.
Yes.
And then what I live for is a bookshelf. Some of the titles.
Would you like to read them out?
I'll pick one and you'll pick one. Okay, Brain Talk. You pick one.
Oh gosh, you picked a simple one. Okay, what I see here is Exploring Desire and Intimacy.
Oh, very nice. Healing the Shame That Binds You.
The shame.
The shame that binds you. Shit, the shame that binds you.
Yeah, I do have a good one. The Erotic Mind.
The Erotic Mind?
Fantastic.
That's a great title.
Yeah, it's a classic in my field.
Okay. Let's keep it going to the next image.
Yes.
Because once we kind of
we're gonna
get
get
that introduction,
into that.
we're going to get back into it for sure. There have been, I think, 2 photos of elephants. And so what country is this made
That's in Thailand.
In Thailand as well.
Elephant Nature Park, yeah.
Yeah. So the photograph it looks almost like there's a bamboo or something in the way because there's something shadowed.
I think it's just a shadow, though. I am officially kissing the elephant's trunk.
Yes. So
again, thinking you just can kiss animals because why not?
And the elephant is responding.
Yes.
So the majority of the image is just you in your baseball caps, sunglasses, leaning in to give the trunk of this incredible animal a nice little bit of affection that they who knows if they consciously or definitely appreciate it, but I'm sure on some level
I think
they must
I
appreciate
think so. I think animals are more in tune, especially elephants, for the reading and the learning that I've done. I think they're more in tuned than we realize. At least they certainly have memories.
For sure. For sure. Okay. Memories. When you came to Hong Kong, did you specifically come to transport, relocate, import your work, knowing that that there would be a market for what you do? Or was it more like, well, I think it will work, and I'm going to come and make it happen? The
main reason I did come was my husband's job. But before I decided, okay, we could do this, I did come and speak to some therapists about how you can work here, do you need to get licensed, and is there a need? And I did get some feedback that there were not many people, or hardly any, that do sex therapy. So I knew it was a good niche to continue on working in. And I also felt like, since I could actually be a psychologist here, I can work and bring sex therapy here. I thought, how fantastic, because in America there are quite a few sex therapists and you can get that support, but I like the idea of coming somewhere where people really need it and they don't have a lot of information. And so I felt like I was kind of filling that need, also being able to continue my work, because that's really valuable to me. Being a psychologist and sex therapist, it's like, it's part of just who you are. You know, it's not one of those jobs, I'll look at a list and I'll check that off and do that. No, it's more about like, it's it's a passion. It's about, you live the work, you breathe the work. So I had to make sure I could continue with that. So when I realized I could do the work here, I said, okay, let's try this new journey.
Wow. So describe how your training, your development. So the different pillars I'd mentioned in the podcast, one of them is service leadership, right? Mm-hmm. So that's like looking at people's maturity and evolution as service leaders. We talk about physicians, doctors, there's the competency of doing what they have to do, mm-hmm. but there's also the service side of who you are. And that's the interrelation, connection, mm-hmm. energy you mm-hmm. create mm-hmm. with the other person. Mm-hmm. Starting from when you were young, mm-hmm. how did that road, what did that road look like that landed you as a sex therapist in Hong Kong?
Yeah. Well, I first became a psychologist. I went to undergrad and I majored in psychology and sociology. I've always just been interested in people. Mm-hmm. Like, why do we do what we do? Why does a brain think the way it does? I've been always wanting to ask the questions and get mm-hmm. to know people and connect with people. There was just something there.
Sure.
So I went into that field and decided, I could continue doing this work. I didn't see myself going anywhere else, but somewhere within this field of understanding, learning, listening, and caring about people. So I went on after my undergrad finished, I went straight into graduate school for my doctorate in clinical psychology.
Oh, wow. Okay.
So I just kind of kept on going. I'm like, you know what? I'm on this path. I don't know how hard it's going to be to get back here, so I'll just keep on going.
Oh, wow.
So I just continued that for another 4 years.
But this was a doctorate in clinical psychology research-based? Like...
You do your own research.
So what was your area?
Had to do with acculturation and gender roles.
Okay.
So it was interesting. Even back then, I wasn't a sex therapist until, when did I become a sex therapist? Like 2013, right? No, yeah, it's 2013. I'm like, that was the date. Gosh, it's been a while. So it was a while before I actually decided to go that path, but I knew that there was gender, sexuality, and also my graduate program had a multicultural focus. Mm-hmm. So we incorporated that because there wasn't a lot of multicultural research going on back in the day in psychology. Right,
and this is in California?
Yeah.
Okay.
Yeah.
Okay, wow.
So that's why I kind of put it all together and kept on going with that doctorate. And at first I worked with all ages, children, groups, adults, geriatric. I did psychological testing, crisis, you name it. You just kind of do it all to kind of see what ticks.
Sure.
And that way you can also know how to work with all sorts of folks. Mm. And then after working at a major hospital and a group practice, I narrowed my work down to just a private practice. I knew I wanted to be able to kind of have my own control and work for myself. So I did a private practice for about 15 years.
Oh, wow.
In San Diego. So that was what I was running before I came to Hong Kong.
Wow. Okay. Wow.
Yeah. And so it was interesting. You're doing your work, you're feeling engaged and interested, but then I always like to learn a little bit more, grow a little bit more. And the idea of sex therapy came up because I had a fantastic teacher in my graduate program, this professor, Bryna. And she was this funky woman who just talked about sex and with so much humor and so much ease and made you feel like anybody could talk about sex. And I already liked talking about sex. It wasn't a big deal for me to discuss those issues, but she just made it so accessible.
Yeah.
And I thought, you know what, bring that to people because there's so much shame, so much embarrassment and discomfort around talking about it or about its own sexuality. So I just thought about her. I'm like, I want to embody that. That's when I looked into, becoming a certified sex therapist, which the organization you mentioned at the beginning, ASECT, that's the largest governing body of sex therapists. So I went through their really rigorous program for about 2.5 years.
Wow.
So you learn about the biology, the psychology, the cultural parts. You learn about so much. And then started working with folks. Wow. And it's been super valuable. That part where when people come into your office and go, I had no idea where to go with this. I've had no one to talk to about this issue. And now I have somebody who can not only understand, but be compassionate, make me realize I'm normal, I'm okay, I'm not alone.
Yeah, I'm
That's
nodding.
The part.
For the people who are listening, I'm nodding like, yeah.
Yeah, that's the most rewarding part because, again, people live with so many feelings around their sexuality and just keep them inside.
Sure.
And too scared to talk about it.
So in my previous life, not too long ago, I have some medical exposure to Hong Kong's medical community. And early on, I was asked to do an interview of one of the heads of Hong Kong's psychology, I don't know, the department with the hospital authority.
Okay.
And we were talking about how many resources there are in Hong Kong around mental health and how for the population, it's really low. Now, have you, in coming here as part of your own, like, whatever you want to call it, due diligence, said, well, how many people are there who do this? And then you realize there really aren't that many.
Well, it's interesting. I've always heard there's not too many really great therapists in Hong Kong, because I guess for the population, you know.
Yeah.
But thing is, I work with let me see. Maybe I'd say 75% expats.
Yeah, okay.
I'd say that's about it, and 25% locals.
Right.
So I guess it depends what group you're talking about and who you're trying to serve. I do believe more lower fee therapists, there's not a lot.
Okay.
So it's unfortunate. The therapists that I know like 100, I'm on a group chat with like 100 therapists.
Right.
Now, they work with all sorts of people, from children in schools to just couples to adults. But I mean, and then plenty of them do work with locals. There are services. It's just for a lot of these services, there is a pretty solid higher fee.
Yeah,
that's the issue, I think. It's not as accessible as it needs to be.
Have you made any observations, even though it's within the expat community, and you have a background in sociology, anthropology, you can make educated guesses of patterns and cultures. So what's the patient profile here? How different is it from here compared to... I mean, California is famously way more open, right? In terms of what you see in your practice, like here in Hong Kong, how would you describe the difference between... Is there a difference?
Oh, yeah. Okay, well, there's a difference in so many layers, but you mean with the sexuality part or just in anything?
But however you interpret that question.
Yeah, because it's interesting. Since I do work with sexuality a lot, there's a huge difference.
Oh, okay.
I mean, people would come in San Diego, and I'd see some multicultural, some different cultures, but not as many as here, obviously. They'd come in with, I think, a lot more knowledge around sexuality, their own sexuality, and maybe fine-tuning things,
right.
or again, having some more specific sexual dysfunctions they wanted help with. I'm finding here with some folks coming in with a real lack of some more basic knowledge.
Right.
And again, sex ed around the world is taught very differently, right? I mean, you have people in, like, say, the Netherlands who have a very broad, open education on sexuality, which is fantastic. Yeah. But then you have other cultures, some more Asian cultures that are definitely have less information. So they're coming in with a lot of kind of expectations that are unrealistic. Okay. And, a lot of things like from the movies, this is how I should be. This is how sex should be. This is how my body should perform. And I have to do a lot of education. Like, that's not real. So there's that piece. But here, culturally too, like I can see, say, 5 clients in a row. I do couples and individual work for adults. I can have 5 different clients in a row from 5 different cultures. Right. With 5 different accents. Right. And then with also like interracial relationships. So it's so dynamic and so diverse. So it's definitely keeping me on my toes. And I'm certainly learning a lot. So you'll have that layer more. Just a lot of, you have to kind of look at, okay, from your religious background and your cultural background, and then in the couple, all these 3 mixed together, right, how do you hold all that? So there's just a lot more layers of that.
Sure. Okay. This is going to be a question that's going to, well, it'll be what it'll be. When you have somebody come in who is reluctant, because it's in terms of couples, right? Yes. So one person will be like, this is a good idea. Yes. The other person's like, I don't want to. And the reluctance in terms of sitting across from somebody, and it's like, I don't want to air out my laundry and have somebody sit there and judge me. So if somebody is listening to that, in that situation, what advice would you give them?
Well, I'll tell you, can I just back up on that question? Because there's different reasons people don't want to come in. So it's about finding out, well, what is this about? Because there are some people who don't want to come in because, look, I don't really want to work on my relationship. I'm pretty much done, which is one set. But there's people come in, and they often will feel like, and I'd say, if I can say, it's usually more men, usually.
More resistant?
More resistant. Not always, but usually because they're not used to expressing their feelings, talking to this woman about their feelings, and especially if it's sex, it's very private. So, I mean, I definitely can relate and understand that. I know I'm the stranger you're talking to, and we don't have to get right into it. I work on kind of building rapport.
Sure.
So I definitely work on making it comfortable for people. Hey, I know when I first went to therapy and how scary that can be, and you have to trust this person, and you don't know how they're going to react to what you have to say. So my main goal is just to let them know they're safe. It's a confident, comfortable place. It's, it doesn't leave this room, what you share. Right. It's all between us. And just kind of help them, be where they are. And as they feel more comfortable, they'll open up and they'll see that there's something you can get out of this.
Right. So one bit of a paradigm shift that I had was, I kind of understand. Okay, quick question. What is the youngest aged client that you've had?
Well, I only work with adults now, but back in the day when I did work with children, I'd say probably about 6.
Wow. Wow. Okay.
Well, because if, say, parents are divorcing and a child's having feelings, then, you want to be able to support them, just give them a place to get out, whatever.
Okay. So what the paradigm shift I got was this idea that a lot of mental health access or treatment is through discourse. Right? So it's like you have to speak and express yourself in order to get to where it is you need to get to have that change. Okay. And then I met this one art therapist who the school of thought is completely, it's more like, I don't care about your story. In fact, you're going to do a process that itself is the therapy. So the process of, for example, working in the clay, the process of using paint, the process of using the color, it's separated from discourse, right? So how do you recognize when somebody comes in and says and offers some kind of issue that is outside the bounds of counseling, but it was within a couple, right? So do you just say, oh, well, in this case, maybe you need to see a psychiatrist? Or in this case, it's more it's more physiological as opposed to a mental block.
Well, if it is more physiological, especially within the sex therapy world, we rule that out. If someone comes in with some kind of erectile dysfunction, or a woman comes in with some genital pain, I'll always say, hey, we need to have you go to your doctor first, make sure you rule out if there's any issue there. And if they say, no, there's nothing that we can find, then we would look at the psychological component. So I do work with other doctors or pelvic floor physical therapists, psychiatrists for medications. Yes, I do talk therapy. Some of my interventions are more body-based, meaning doing some breathing exercises, touching exercises. So there is that component. But if I feel like they might benefit from a different treatment modality.
Sure.
Like you mentioned art therapy. Some people are more into that. There's also, more trauma-related therapies that do different kinds of things that aren't about talk. Right. So there's enough little specialties you can kind of send somebody to someone you trust that is in that if you need to. Right. Yeah. I hope so.
How do you feel?
I'm good.
Awesome, great.
Like I said, it's like I'm used to asking the questions, so this is nice. This is a nice difference.
So with a title like Shooting It Raw, don't spit out your water. So the title of Shooting It Raw, my gay friends are just like, that sounds like a really good podcast. I'm like, slow down. Slow down. So I want to get I want the 5th theme pillar to be sex and sexuality and mental health, for sure.
I gotcha.
And so what can you say to let's get outside of Hong Kong. Yeah. Let's just pull back and say, just overall as a human animal, the species, what has your experience shown you about because I find it shocking that words like shame are part of. I kind of feel like at this day and age, really,
yeah.
But clearly.
Yeah.
So what wisdom can you give about that whole part of helping people?
One thing, if I'm hearing you ask this question, and the way I interpret it, like, one of the gifts I try to give, if you can call it a gift, is that help people realize that there's such a huge variation of normal. And the thing is, when people's bodies don't act a certain way, the way they want it to, and maybe I should explain that because I know what I mean, but like, oh, I am not getting the erection I think I should get, or I'm not getting aroused, the way I think I should, or I'm not doing a sexual act that my partner wants, or I'm not turned on 24/7 like I think I'm supposed to be. Like, there's so many versions of what's normal. And so people come in thinking like, I'm not good enough. I'm not going to be wanted. I'm not going to be loved the way I am. There's a lot of that. I mean, there's so much more I could talk about around shame and sexuality from history. But that, when people come at that, I just try to help them see, look, who you are is who you are. Let's love you for who, you love yourself for who you are. Be the best version of who you are. Have compassion towards your own experiences in your body and towards your partner, and have empathy. And I think the best of you will come out.
Okay.
So I think that's a piece. I mean, obviously, again, if there's like some kind of physical or something that needs to be kind of taken care of physically, okay, we can do that. But otherwise, I just feel like it's such an important piece. If people come in, shame gets passed down to people too from like families. Like, say parents, got shamed for doing certain things. I don't know how explicit.
As explicit as you like.
Okay, because I'm trying to like be polite.
Shoot it raw. Like,
okay, how else? Okay, but that's right. From like kids getting caught masturbating, for example, and they get told, "Don't you do that? That's bad." It's like, you might think that's just one message, like one conversation, but they might internalize that like, oh, touching my genitals is bad, or sex is bad. Or I'll have people, oh gosh, I see this quite a bit, where maybe in their religious background it says, okay, sex is for when you're married, so you can't have it before you're married, and if you think about it or try to do anything sexual, it's bad and shameful. But then they come in to see me because they're married, and they expect all of a sudden like a light switch, they're gonna have great sex, and they don't understand why. It's like, well, because you've had years and years of being told it's a bad thing, so how do you just switch your brain? So there's a lot of that I have to kind of work on working with people. And again, sometimes, parents might shame their kids not meaning to, but that comes into play. Or people just have like experiences, like sexual experiences where maybe a partner, was unhappy with them and shames them, and they laugh. Oh, I've had that. Or like, oh, look at you. And oh no, that's like traumatized them for life. So there's things like that.
Such a nice way of, that traumatized them for life. It's fine.
I'm so used to talking about it that I think I say it like that.
No, it's great. It's great.
Yeah,
No, I love it. So I've been here 17 years. My perception of the Hong Kong experience is very dense, right? Super densely populated. Lots of action, lots of intensity, but the cost that I've felt personally, so I've had 3 near-death experiences, totally fine. No, nothing.
Wow.
But then, living in Hong Kong during the financial crisis, totally brought up general anxiety disorder, so I had to actually medicate for it, for panic attacks. I think to myself, life in Hong Kong, which is so full-on, is kind of what triggered all these things. So in terms of mental health and sexuality, where you need intimacy, you need that quiet space in a society where you're so like, there is no real quiet, or no, there's no quiet space, but there is no, like, Hong Kong is famous for like in those sex surveys that they have as one of the lowest scores in terms of sexual frequency. I don't know if that's just because I was in funded by Trojan, I think, a few years ago, of course.
So you gotta look at
but I don't know how scientific it was as just a qualitative survey, but I kind of feel everybody living on top of each other, next to each other, with no space.
I'll tell you.
Okay, please do.
I talk about this one. I'm going to talk about the anxiety in a second, but the pandemic. With people stuck on this island, a lot of people not going into the office, in each other's space, and already small spaces. I've seen a lot of sexual challenges, a lot of lack of desire. People seeing their partners like, yes, and you're on the couch, and you're in your casual clothes, and then you're working in the office, which is literally on our kitchen table, and we have no separateness. Mm-hmm. I've seen a lot of challenges in couples because there's no sense of longing, of missing. There's people who's like, yeah, my husband would go traveling. He doesn't travel anymore, or at least go to the office, and we'd have some missing yous during the day.
Right.
There was none of that.
Right.
So a lot of people then are with each other 24/7, and then the challenges that they have that maybe they could travel and forget for a bit, come to the surface even more. Mm-hmm. And it's this manufactured like time together that's just too much. We can't be with each other that much and think we're going to be happy for most people. So that's created a lot of challenges. I also think, the anxiety piece, this is a go, go, go city too. It's like go on busyness, hecticness on each other. With that anxiety, that is a big, presents as a big challenge for sex for a lot of people. It's the anxiety and worries that when you're in your head and you're worrying, you're disconnected from your body.
Sure.
So a lot of times I'll work with people to try to get out of their head and more into feeling their body. So
like butt plugs, I guess.
That's one thing you can use.
I'm just projecting. Sorry.
I love it. No, you're going to answer.
It's just a way of getting a person out of their head.
That is, and into your ass. Exactly.
Yes, there we go. The thing is, if this episode doesn't get a little bit into it, I'm gonna have friends who are gonna be like, "Come on,
give me some more.
Yeah, come on, some more.
Something exciting there." So anxiety, absolutely.
Yeah. Because for me, as an observer who, for whatever, so my parents were very undemonstrative about their sexuality. Mm-hmm. Really not sexual in front of the kids. Yeah. And so,
there's an element of that. They're not having sex in front of you, which is good. But there's probably no intimacy, no touching or...
There was never this feeling that they were a sexual couple.
Yeah, I gotcha.
Whereas for all the people who know me, I'm Mr. TMI. So I'm way on the spectrum of a little bent, right? And so
you went the other direction.
Yeah, I just went a little bit in the other direction. And so, which is why I'm quite sensitive to what I see around. And I just feel that as a thing, the pandemic has really, in terms of era, clearly is something that really will be spoken of historically. And then there was the pandemic in 2019 to 21 or whatever. That
hopefully that's where it ends.
Yeah, hopefully. but so as somebody who's doing the counseling and the therapy, and so the cases that have come in, has that spiked a huge demand for you just to shift over? I'm seeing couples who are really just irritated with each other more than anything. Mm-hmm. So what generalizations can you make because of how people are presenting to you?
I think there's a spike in cases for everybody that I know. Everybody has a wait list for therapy. Yeah. Oh. It's just a ton of need, a ton of anxiety and depression and hopelessness and feeling lost and not having faith. The couples, like I mentioned before, the lack of feeling passion, lack of feeling an energy and a sense of planning. It's what am I even planning for? Right. Is this going to be over? I think in Hong Kong I have our version versus other places. Yeah. I think when people that if their job has been impacted, that's been impacting obviously them on an individual level. Yeah.
So as you work here, you said you're connected to about 100 other therapists or whatever. How much exchange is happening between you on that level to say, well, in terms of learning about cases or in terms of the knowledge? So, for example, in epidemiology, there are a lot of different people tracking, for example, right now with the pandemic, what's actually happening. So there's a good sense of what's going on in public health, right? So is there that resource for you as well to understand, well, Hong Kong is generally in this direction? Or
as Hong Kong in general, I just know what my other colleagues are saying and how they're working. I'm not sure where Hong Kong in general is as far as getting through this. I do think I can predict as, borders open more, quarantine is less, and people are kind of living what they quote normal life again. I think there'll be more joy and excitement, and those things that were seemingly so simple before are going to feel exciting again, like leaving this place and going like to Thailand or something. It's just going to feel like the first vacation you've ever been on.
Right.
It's going to feel so ecstatic, and maybe that'll put some spice back into the relationships.
Okay, right.
That's what I hope.
Yeah.
So I just know, people are still, again, inundated with people feeling overwhelmed and lost and anxious, and I think it's going to take some months before we kind of get out of this.
Right. I'm just brought back to that image of you on the beach, arms wide, sun hitting your face, shirt that says love, like embracing the world. As a personality type, how would you describe yourself as you see the future? How do you see the future? What colored glasses do you wear?
Oh, I tend to be an optimist. I know we'll get through this. I think, in the moment, I can feel kind of heavy, a little bit burdened down. But I get out of my head and I pull back and I go, you know what? We're going to get past this. We're going to figure it out. I mean, we've been through these things before. We're going to, and that's the thing I teach my clients. You've been through struggles and hard times before. You'll get through this as well. And then you'll realize, okay, things will be okay. It might be a different version. So I look at it that way. I mean, we're going to get to some version of life that we're feeling joy and connected and living purposeful lives and feeling that love again. It just takes some time, but we'll get there. I know it's, that's the thing when you work with folks, again, when people are depressed, for example, and they're in this one moment of despair, it's hard for them to see that there's that even tomorrow can be different. But that's the faith I hold on to for people to go, I know that just sometimes we wake up the next morning, sometimes your mood's a little bit different. Sometimes you just see things a little bit more clearly. So you'll get through this. We will all get through this, and it's just remembering that. For
sure. What I love about what you're doing is people come in with a clear understanding that something needs to be looked at. And what I really love about it is it's this territory of relative confusion or lack of clarity or whatever it is. People sex and sexuality is there's a lot of baggage, a lot of hang-ups for many people. Very much. So what I love is that people come in and you're not seeing the people who are actually no baggage, whatever, right? So in a way, your role is to create a breakthrough. Your role is to kind of create this service, this energy between people to open doors that they haven't opened and kind of... So what is describe a transformation or that, without giving confidential information away, but something that really for you felt psychically rewarding, and just this is why I'm doing this.
Oh gosh, let me see. It's hard not to give details. So I just think when people are so entrenched, I've seen this a few times, when people are so entrenched in these negative interactions and seeing their partner in just one way, when I can help them shift their perspective and realize, no, there's so much more to your partner than you're seeing right now, and help them ask questions and get to a deeper, more intimate questions and deeper understanding, then they can start shifting their vision of that person, and then it shifts their behaviors. I know that's kind of a generic answer, but I in thinking about specifics, not wanting to give too many details. I think with the sex part, when people let their guard down and then risk showing up doing things that they're too scared to do. Meaning like we get in our ruts, right? We start with sex kind of you get excited and you try different things out. And then as you go along in a long-term relationship, it narrows down to these things that are very same old, and you get bored. And so when people sometimes will have some thoughts of maybe what they want to do, but I'm too scared to bring that to my partner, even after 20 years, I'm maybe not comfortable, too scared. But when I can encourage them, no, risk that. Risk showing up as your full self and being that person you want to be and bring it to the partner. And then all of a sudden you can have a different sex life than you had ever thought you could have. Okay. And it's about having an open mind. And it's your own willingness to risk. Not focusing on your partner either and going, oh, well, if they'd only change, then I'll be different. But more what are you willing to do to show up differently in your relationship as a couple or as a sexual being? That's kind of a dynamic I like to help people focus on.
Got it. Somebody who's listening to this from, I'm going to pick on New Zealand. No, not New Zealand. Let's pick on somewhere else. Just somewhere not Hong Kong, not the US, not let's say Austria, who's in a rut for whatever reason and would like at least a basic something they could do right now to...
Like a takeaway?
Yeah, takeaway to kind of add some energy into their relationship, because ultimately it's a reflection of who they are in the relationship, right? So if they themselves aren't the source of like creativity and playfulness and risk taking and whatever, so what can we say to help that person go, oh, okay, I'm going to try something else?
Like sexually in their relationship? What could they do differently?
Yeah, or what, in terms of how, like, to shift their attention to something to open a new door.
See, when someone comes in the office and we have that, say they were to say, like, what can I do differently? We'd go deeper. You know, we'd go deeper to go, well, what's that coming from? What kind of feeling are you wanting to create? What kind of experience are you wanting to create if you're with a partner versus are you alone or with a partner? I mean, when it comes to partners and relationships, I often go, are you even talking about sex? It's amazing how many people are not talking about sex with their partners. They might have a gripe here and there, but they're not really talking about what it is that they truly want. Okay. Like, who am I sexually? Like, what really does turn me on? What conditions? What experiences? Do I have any like interesting fetishes? Do I want to be dominant or submissive? Do I want you to tie me up? You know, do I want to play with some toys? Have I acknowledged this for myself, or have I even told my partner this?
Right.
Some people just go along with this, like maybe vanilla sex, because they think that's what they're supposed to do.
Right.
And don't even talk about what it is they truly want. So I think getting in touch with what you truly want and risking saying that to their partner can certainly... It sounds so simplistic, but again, people don't even go that route.
It could be basic or fundamental without putting this simplistic. Maybe simple is good, right? Maybe that's a good thing. So let's talk about this idea of dominance in a relationship, right? So somebody pointed me to a podcast where this woman was giving a class on how to give blowjobs, right? So she did this course. It was originally started in Chicago as a course for women on how to give a great, fantastic blowjob. Yeah. And then she's done these seminars, and she talks about it on this one podcast. So from a therapist side, how do you articulate the role of dominance within a relationship?
Well, so blowjobs and dominance, I guess, would be kind of different things, depending. Yeah. You know, I think that's great. By the way, people taking courses, I think, you know, sex ed, anywhere you can get it is fantastic. I mean, dominance, there's a power exchange that's often inherent in every relationship, some level of power exchange. And some people just feel so excited by having that control over someone, telling them what to do, feeling like I'm the one that they're taking care of. So how would I explain that? Or I think if someone was curious about that, I'd talk to them, like, what does that mean to you? Like, I'd pull from them, what does that mean to be in control? Does it mean that someone is, you know, licking your boots? Does it mean that someone's just talking to you a certain way? Is it, you know, what is it? Is it verbal things? Is it physical things that you're wanting to see? I mean, is this what you're wanting? Right. You know, not everybody wants that, obviously. Sure. So if they seem to be kind of like, oh, I want to play with that a little bit. Because like, being a sex therapist, we often get into the deeper therapeutic part. Right. While sex educators do a lot more of the educating about just all the different sexual things you can do. But I do incorporate some of that. Okay. So I'll give some bibliotherapy or some videos one can watch. But I could also talk about, like, what does dominance mean to you in this relationship? And how would you want to play it out? Now, is this are we talking about like a daily thing, or is this like, okay, you get in the bedroom and all of a sudden you have these particular roles you're playing, and how do you want to set that up, and then what are some safe words? I mean, it depends how far we're going to go with that. Sure. So we kind of flesh it out based on what their needs are.
Great pun. So how do you set? Okay, so you're talking about there's the therapeutic side versus the education side. How do you focus intellectually on what is the therapeutic side in terms of? Is that purely around treating some issue?
Like, for example, say some woman comes in and she's like, I haven't had an orgasm and I don't know why, I feel like I should, and I've had sex and yada yada, never had an orgasm. So we'll look at kind of decision trees and like, okay, well, making sure everything's functioning in your body, is this a technique issue where I might suggest, okay, a vibrator is often very helpful for women. I could educate on, okay, just because you're having intercourse doesn't mean you're going to have an orgasm.
Sure.
There's usually clitoral stimulation you need. But then I'd also look at, okay, well, let's psychologically look if there's anything getting in your way. Do you have any mental blocks?
Sure.
Oh, if I know a woman, for example, maybe has a history of sexual abuse,
right.
If that's there and that's impacting it, just for an example, then we'd work on treating that trauma around
right.
that,
right.
helping her relax, helping her get in her body and healing that trauma. So we have to kind of look at what's underneath the issue.
So one of the things that I know from my own personal experience is to kind of just that self-acceptance of just what is normal, how do I fit under what normal is and all this stuff. So how often do you have people who come, pun intended, come and say there's a problem, things aren't happening the way they should or whatever, and so how do you disentangle people sort of being fixated on, well, this is what should be happening, or this is what I think should be happening, and that creates a kind of self-perpetuating, and that creates the block, right? So how, if you could talk about how often or how much is that a part of your practice?
Oh, that's what I was saying before. It's a big part. I mean, from either movies in a heterosexual couple, woman and man having sex, and 30 seconds she's having an orgasm, and she's already plenty turned on, wet, gorged, all of that. It's like, that doesn't happen every day. And there's a lot of the shoulds of, okay, I'm with my partner, I should be able to just look at them and be turned on.
Right.
And why am I not? And I'm I explain the sexual response style, spontaneous desire versus responsive desire, and there's differences there. There's just a lot of, the normals around penis functioning. The pressure on the penis is amazing. I see a lot of that where...
I love that sentence.
Pressure on the penis.
The pressure on the penis is amazing.
It's like, stand up! Perform! It's like, that's when we talk about performance issues. It's like, it's not a performance. It's your body responding to stimuli. But when you put performance on it, and there's a thing called spectatoring, when... Again, a penis owner will look down and go, okay, is it doing what I want and why not? And so they're in their head analyzing their penis, and it's like, you are so not in the mood and in the moment. So we say that pleasure is the measure, not this performance. And I really have to work a lot with couples, actually gay or straight or bi, whomever, if there's a penis involved. It's about focus on how we're connecting, how we're feeling good. If it does lose its erection, focus on doing other things. Sure. Focus on kissing, fondling, touching. Focus on pleasing your partner in that moment. And the more we have a partner who's supportive of that, the better off we are. But it's when we have these expectations of once it goes up, it should stay up at my age. Say at 25, once I get an erection, it should last X amount of hours. Right. It's these things people get in their heads and just can't shake. And that's where I have to really be firm. No. You're expecting something, and educate on, do you know penises do go up and down even during intercourse to some degree? Yeah. It's interesting how much people really have to learn that. But when they start learning it and start normalizing it and taking the pressure off, the body wants to respond. Sure. That's a big piece.
I like it. How do we connect that to elephants?
The trunk goes up and down.
Okay, so
it's a big trunk.
Well, okay, no. It's not about penises. Anyways, that one's a female. That elephant's a female.
Oh, I
yeah, because the males don't circulate at the Elephant Nature Park. They tend to be the females.
Oh, that's right. I forgot. Yeah. Well, she's beautiful.
She's great. She's great. In a weird way, connecting strange questions together can sometimes reveal something, right? So how do you interpret this question? I say to you, you're going to be on this podcast. We're going to have this discussion. It's seeded, also pun intended, in advance that we're going to frame it or something. The reason why I reached out, again, pun intended, is because of your work. And so I say, send me some photos. And maybe you're just like, what the fuck? This has nothing to do with anything. We're talking elephants. But however you make that connection is interesting. So how would you connect?
Well, honestly, your podcast is very unique compared to other ones I'm familiar with. Like some of them might be like, it's a health podcast, or mental health, and we're going to mental health. And it's very linear, and I got that. Yours was different. My brain was like, wait a minute, you're saying pictures that seem like important to me or kind of where I'm at, but we're also going to talk about sex therapy. And it's funny, it's like, there's both parts. And so for me, it was all about connection to home, the love I was feeling in that. Mm-hmm. And I feel like my spirit came out in all that. And my spirit is also in the work that I do.
100%.
I am like me. Like, see my animated arms flapping about? Yeah. Like, I gotta tie them down in order to, like, not be me. I'm that. So, and I gotta watch my face because I express a lot.
No, it's all good. It's all good.
So, like, those are me. This is who I am. This is the work that I do. And I bring that passion to my work. And I think then that, in turn, I hope, and I do believe, helps people feel relaxed and comfortable to then be their full selves. Yep. And share that in that space. Yeah. The last thing you want to do is feel like you're in a restrictive space when you're talking about sex.
Yes.
So there you go.
Well done. The reason why we met was because Julia, who is on the podcast, in her case, she's a small business owner. I met her within that umbrella of photography. And then as I'm pestering her to give me the images, she says, I was just been, diagnosed with stage 1 cervical cancer. And I'm like, and she's like, let's have a conversation to make it aware in public and sort of be part of her processing of getting cancer. And when I said to her, who can you suggest? She suggested you. And so, and she also mentioned shame. She thought, and then another person mentioned shame. This is my sister when she said she got COVID. And she lives in Georgia in the USA. So it's interesting how, so we have our experience and your job, which is really great because you have people living their lives however they live it. And then they come here and they say to you, something's not clicking. Yeah. Something's not meshing or whatever. And you're there to observe and say, okay, let me help you shed that shame and just kind of deal with how things are, right? Mm-hmm. So do you feel that the concept of shame within Confucian society, like Hong Kong, China, where there is the Confucius, shame was an important part of social pressures. Yes. There's a service. It serves a purpose. Okay. In society. Right. In different societies. So, professionally speaking, how do you see, or sociologically speaking, how do you connect shame within the culture? Yeah, that's a good point. It took a long time to get here. Wow. Sorry. Good question. I'm glad you got to the point. Alrighty. Well, I think whether you say shame or other things, you have to be so sensitive to the culture. First of all, I'm a guest in, right? I'm an expat here in Hong Kong. I'm not going to act like, I'm not going to come in here and go, here's how you should be living your lives, folks. Mm-hmm. No, you got to be so sensitive to what these all serve, like again, what shame serves and saving face and all of these different cultural dynamics. And that was an interesting piece of starting to work here with local folks. I'm like, okay, then how do I bring in my knowledge, my Western trained ideas that are research based, but not all on multicultural focus. How do I bring some of this information though to these folks in a way that helps them while respecting their culture and their dynamics? So that's definitely a dance. So I'll try things out. I'll suggest ideas. I'll say, how does this feel for you? And, see what people are open to and what not. But when it comes to shame, I guess there's a part of how people present themselves out in the world. I just think when it comes to sex in your bedroom, wherever you're doing it, as long as you can feel free to be who you are, that's the core piece, So, yeah, again, however out in the world that shame's used or parents, that might be a little bit different. I just want people to feel like, how do I love myself for, my body, the way it was born and the feelings I feel and desires that I have. How can I accept that and love it and feel free to express that with another consenting adult? Thank you. Thank you.
Sure.
Done.
Okay.
Awesome.
Bravo.
Thank you.
Thank you. Thanks Thanks for having me on. This
really
has been
good.
fun.
This is great.
Shooting it raw?
Yes. Shooting it raw.